Welcome to the Fibromyalgia Podcast. I'm Tami, fibromyalgia coach, author, and founder of the International Fibromyalgia Coaching Institute. The goal of this podcast is to empower you with access to the dream team of experts and coaches I've discovered are key to living the fibro life you love. From the comfort of your own home, and maybe even your pajamas, I'll help you take back control of your life and health. To help out with fibro fog, I always include full show notes and additional resources at fibromyalgiapodcast.com. Welcome to the Fibromyalgia Podcast. I'm your coach, Tami, and this is episode 91. In today's episode, I'm going to give you just a real brief overview of some of the other conditions that I see often get overlooked after someone has been diagnosed with fibromyalgia. In episode 87, I asked the question, what if it isn't fibromyalgia? This was something that came up often in our last Certified Fibromyalgia Advisor class. As my students were learning about their fibromyalgia, many things came to light that weren't fibro. As they were learning about thyroid and adrenals and all these other things that contribute to fibromyalgia symptoms, it made a lot of light bulbs go off for my students in realizing, oh, maybe there's more going on with me than just fibromyalgia. If you haven't heard that episode, I definitely recommend checking it out. We will have a link in today's show notes. Just go to fibromyalgiapodcast.com/91, and all of the episodes I'm going to talk about today will be listed out there. Now, years ago, when I was younger, I heard a story that bank tellers don't actually study counterfeit money. All they study is the real thing, actual dollars, actual currency, money. Now, I don't know if this is true or not, but the point was when you really know in depth the real thing, then it's easy to spot the fakes. And I think it's a similar thing with fibromyalgia. Not that one is real and one is fake, but just when you really know fibromyalgia or really know any of these other conditions, it becomes a lot easier to spot when it isn't one or the other. So a lot of times when I'm talking to a client or even in a consultation, I will pick up on little clues that tell me there's probably something going on in addition to their fibromyalgia. Every so often, I've even told people, I'm not sure this is fibro at all, because there are clues that tell me this doesn't match up with the thing that I've studied so much. Now, obviously, I'm not a doctor. I'm not making a diagnosis. But oftentimes, I am the person that they're talking to the most in depth about their symptoms. When I have a consultation with someone, it's usually about 90 minutes long. You are not going to your primary care and having a 90-minute appointment. So a lot of times, you don't have time to tell your whole story, right? With me, oftentimes, you do have a lot more time to tell your story. The other thing that happens is that, this is all I do all day long. Fibromyalgia all the time, every channel, every day. Now, that means that I know more about fibromyalgia than probably your average doctor on the street. It's not that I can diagnose you. It's just that I have been around it so long. I have been doing so much. I was diagnosed in 2007, and I have been a coach since 2009. Depending on how long your doctor has been in practice, I may have even been doing this longer than them. But the doctors, as you hear me say on this podcast all the time, they are not taught that much about fibromyalgia, if anything, when they are on medical school. Your primary care needs to have knowledge that's an inch deep and a mile wide, as we say. They need to know a little bit about a lot of things because they are your first point of contact right? You go see your primary care, and then your primary care sends you off to specialists. Now, that means when you describe certain conditions, the little clues that differentiate one illness from another may or may not be caught depending on how well they know those other conditions, kind of like those bank tellers with the counterfeit money, right? Bank teller in the US can probably really spot a US counterfeit $20 bill, but they may or may not be able to spot foreign currency that comes in, right? Because they haven't studied that as much. I so often see people posting about all the symptoms fibromyalgia has, maybe even listing out a big post with all the different symptoms. And it's true, all of us experience fibromyalgia in different ways. But much of what people blame on fibromyalgia are actual other conditions that you have with your fibromyalgia. So, for example, migraines are a diagnosis all on their own. IBS, irritable bowel syndrome, is a diagnosis all on its own. Someone could be diagnosed with those things and not have fibromyalgia. They have diagnostic criteria, they have treatment protocols. But when somebody has fibromyalgia, instead of seeking treatment for these different conditions, they often get blamed on fibromyalgia. And so the patient and the provider feel like they are treating these other conditions by treating fibromyalgia. And that may be true. I know when I was diagnosed with IBS, after I was diagnosed with fibromyalgia, all my doctor did was increase one of my fibro meds. But that was because that same medication was used to treat IBS, right? So when we realize that these are other conditions and not just a symptom of fibromyalgia, often that opens the door to having those other diagnoses treated and treated properly. And as you hear me say all the time, fibromyalgia is an amplifier. And so when we recognize these other conditions, treat these other conditions, reduce the symptoms of those conditions, it then reduces your overall pain, fatigue, and your fibromyalgia. Good example is those headaches and that IBS, right? A recent student of mine did not focus at all on her fibromyalgia, really, in class. All she focused on was, how do I get these headaches under control? And by treating her migraines, everything was so much better. And she was actually the person in her class who had the largest improvement in her fibromyalgia. So it's interesting how that sometimes works out. Now, to give you an example, I'm going to list out a list of symptoms here, and I want you to tell me what you think. Someone says, I could go to the chiropractor every day. It seems like something is always out of place. Maybe you go to the dentist and your dentist comments on little extra cavities and dry mouth. Maybe your eyes are drier and you're always using eye drops. Someone says, every morning I wake up, I'm still exhausted and I have a headache. My legs really hurt more than anything else. I really feel worse in the summer. A lot of people with fibro feel worse in the winter when it's cold, but I actually feel worse in the summer. Maybe you have a racing heart. Maybe you are extra sensitive to medications. You are the person. If there's a side effect listed, you are for sure going to be the one who has that side effect. Or maybe even the things that you take to help you feel better make you feel worse. Tremors or shaking hands. Nerve pain, pins, needles in your feet, in your hands. Now, does that list sound to you like any of your fibromyalgia experience? I know there's several things on here that for me have been part of my fibromyalgia experience. But here's the thing. Every single one of those things I listed out are actually clues for me. Clues that it's not fibromyalgia, or rather that it's something else in addition to fibromyalgia. I very rarely talk to somebody that I think doesn't have fibromyalgia and has something else, Most of the time, I think that it's one of these comorbid, they call it comorbid diagnosis that has come with their fibromyalgia, like the headaches and the IBS I was talking about, where they actually have both. Now, before I start describing some of these conditions and telling you what these different symptoms point to or clue me in on, of course, I've got to remind you this is my disclaimer, the information that I share with you on this podcast, especially the information that I'm giving you today, is not intended to be and never should be considered medical advice. It is definitely not intended to replace consulting with your own physician or healthcare provider. Please don't diagnose yourself from what I'm about to share, nor do I diagnose my own clients. Instead, what we're doing here is educating you, giving you a little bit more information so that you can take that to your doctor, maybe ask better questions. Go to your doctor and say, hey, should we check into this? Maybe you can look it up, learn more about these other conditions to determine if that is something you should be concerned about. Today is definitely going to be a very shallow and brief overview because, of course, each one of these conditions could be a whole episode in and of itself. And with that, I do want to mention Dr. Jessica Drummond has been on the podcast a couple of times now to speak about specific conditions. In episode 68, we did an interview with her about endometriosis. So if that's a diagnosis that you have, or if you have really painful periods or abdominal pain, that might be an episode to check out, episode 68. She also did an interview with me on her experience with long COVID. That was in episode 79. Now, again, we'll have links to both of these in today's show notes. Go to fibromyalgiapodcast.com/91, and we'll have links to both of her interviews. I also have one of my coaches coming on in the next couple of months to talk about her journey with fibromyalgia and Sjogren's. Now, I'm not even going to try to spell that for you, but just know if that rings a bell for you, then just pay attention. She's going to be coming on when we get closer to Thanksgiving here in the US. She'll be here in November. Now, let's talk about those various symptoms that I listed out and why they are clues to me that something might be going on in addition to your fibromyalgia. So the first one I mentioned, I could go to the chiropractor every day. It seems like something is always out. This clues me in they might be extra flexible or extra bendy. Now, I will probably ask a few other questions about that, like, are you extra flexible? Are you able to bend your fingers back far? Were you in gymnastics as a kid, extra flexible? If they say no, then, it could be something else. But if they're like, yeah, it definitely does, then I might suggest they talk to their doctor about Ehlers-Danlos syndrome, often just called EDS. That's what the EDS stands for, is Ehlers-Danlos syndrome. Now, this is a genetic connective tissue disorder where your body doesn't make collagen properly. Now, connective tissue, collagen, is used in everywhere in your body. It is used in your joints, right, to help hold things in place. It's in your skin, so your skin might bruise easily or be extra fragile. You might have more subluxations. That's where your joints could be spine, could be neck, could be elbows, fingers, where they dislocate easier. And a subluxation is either incomplete or a partial dislocation of a joint. So that would be where your shoulder isn't quite in the right spot, but it's not completely dislocated either. That's what a subluxation is. So with Ehlers-Danlos syndrome, we see that all the time. My clients who have EDS, my hip is out. I can't walk. I need to go see someone to put my hip back in place. And something is always coming out of place. So this is a good clue for me that maybe they need to talk to somebody about EDS. It can be quite difficult to find someone who is a specialist in EDS and really understands it. And to get a true diagnosis, they actually need to look at your genetics because it is a genetic mutation. So it can be a little bit difficult to get a diagnosis and to find somebody to treat you. But that being extra bendy, or I could go to the chiropractor every day, something's always out, is a clue for me for Ehlers-Danlos. Now, I mentioned going to the dentist and your dentist telling you that you've got extra cavities and you've got dry mouth. The first thing that I would be wondering with that is, how do you breathe? Do you breathe through your mouth or do you breathe through your nose? If you breathe through your mouth because maybe you've got allergies and your nose is plugged up, then end of discussion, that's probably what it is. If you snore at night and you're breathing through your mouth at night, that would actually clue me in. You probably have sleep apnea. Or if you have a CPAP machine and you are breathing through your mouth at night, again, we're back to the, nasal congestion, allergies, sinusitis, things like that. But if you're like, no, I don't snore at night. Nope, I don't breathe through my mouth. All of those things are coming back. Nope. I don't have sleep apnea. Then I might suggest talking with your doctor. I will ask a couple more questions. Particularly, I'll ask you if you have dry eyes and dry mouth. And if you do, then Sjogren's, which is the episode that'll be coming up in a few more weeks, that will be what I would suggest. So if you have dry eyes where you're using a lot of eye drops, or your eyes just feel like there's sand in it, or your mouth is extra dry, like the thought of eating a cracker, a saltine cracker without drinking any water, like you just can't do it, right? Those are good indications of Sjogren's. And Sjogren's is a condition, it's an autoimmune condition that actually attacks the moisture producing glands in your body. So things like your salivary glands, right? Or the glands that produce tears. That's why those are perfect indicators that something else is going on. Sjogren's, the symptoms of Sjogren's, the dry eyes, the dry mouth, that is not something that fibromyalgia on its own we would typically see. So whenever I hear somebody talking about that, I think, we got to check out Sjogren's. And a rheumatologist will be the person that you see for that. And there's different tests that they can run. Your eye doctor may also be a good source of information for that, depending on how they've been trained. The next one on the list was waking up in the morning and being tired and having a headache. That is a pretty classic symptom of sleep apnea. Yes, with fibromyalgia, we do wake up tired and we often have headaches. But if you wake up in the morning and you have a headache and then it gets better over the course of the day without you even taking anything, then that headache could be caused because you were stopping breathing at night and your brain was not getting the amount of oxygen it really needs. And once you're awake and breathing normally, your brain gets the oxygen it needs and it feels better. So if you're waking up in the morning with headaches that go away on their own, or if you're snoring at night, or really, honestly, if you have fibromyalgia, talk to your doctor about possible sleep apnea. The reason I say if you have fibro, talk to your doctor about sleep apnea is because almost half of us are diagnosed with sleep apnea. It's actually 45%. Now, in a non-fibro, like everybody else in the world, that percent is much, much smaller, less than 10%, 2 or 3% in some cases. So your doctor may not be even thinking about sleep apnea and may just be blaming your fatigue and your headaches on fibromyalgia when that is something that can actually be treated. So that's a clue there. I mentioned leg pain. Oh, my legs hurt worse than anything else. I love it when somebody says this to me because it's like bells go off and, the heavens open and you hear the angels singing, oh, because that is the classic clue that there's something going on with your thyroid. Yes, with fibromyalgia, we hurt everywhere. Our legs hurt, our arms hurt, everything hurts. But anytime somebody tells me that their legs consistently hurt more than anything else, I'm clued in that they probably have something going on with their thyroid, and I'm going to be talking to them about how to ask their doctor to do a full thyroid panel and to really check things out. I also just want to say real quick here, since we're mentioning thyroid, that your doctor running a TSH, that's the thyroid stimulating hormone, a doctor running just that lab alone is not going to tell you if you have a problem with your thyroid or not. So if you've had a TSH done and your doctor says, nope, your thyroid is fine, nope. We got to check a lot more things. TSH isn't even made by your thyroid, it's made by your pituitary. And it honestly, in a healthy person, everything working like it's supposed to, your TSH will tell you what your thyroid is doing. But of course, we're not a normal person, right? Like we already know we have things going wrong with us. So there could be more things that are going wrong. That's a whole nother podcast episode. I literally spend a full week teaching on this with my Certified Fibromyalgia Advisor students. So we'll have to do that as a separate episode. But if you have lower body pain, more than anywhere else, we have got to start talking about your thyroid. And we've got to be looking to see, is this autoimmune thyroid? Is this just hypothyroid? Is there a conversion problem where your body isn't converting the thyroid hormones properly? There's a lot of places where it can break down, and having body pain in your hips, your legs, that is a classic pointer to your thyroid. I mentioned feeling worse in the summer. I've been a coach now for 13 years, and I would say the typical fibro person generally feels worse in the winter. The cold makes our muscles tense up. The darkness makes us a little bit depressed. We don't have the vitamin D we're supposed to have in the winter. So, a lot of times, my clients feel worse in the winter. But occasionally I'll run across somebody who says, actually, I feel worse in the summer. The light, the heat, the sun, it all just makes me feel worse. Maybe they feel extra sensitive to sunlight. Maybe they're literally more painful, more tired in the summer than in the winter. That to me points potentially to lupus. Lupus is an autoimmune condition that attacks your skin, your joints, and your organs. The body's own immune system is attacking healthy tissue. That's what the autoimmune means. Often with lupus, there will be the butterfly rash across the nose and the cheeks. That's the symptom that most people are familiar with if they know anything about lupus. But feeling more painful and fatigued in the summer is a huge piece of this. The light actually makes lupus worse. It's important if you have lupus to use sunscreen and not be in the sun too long and all of these other things. And of course, if you're blaming it all on fibro, then you might not be doing that quite like you should, and it's making things worse. So if you are noticing that, talk to your doctor about whether or not this could possibly be lupus. There's tests that can be done to see if that's what it is or not. And a rheumatologist, of course, who's going to be treating you with that. Often your primary care can do a certain amount. Sometimes you'll need to see a specialist like a rheumatologist. Now, what if you're that person who is extra sensitive to medication? I jokingly talk about my husband being Mr. 1% because he kind of tends to be one of those with certain things. But if you're that person, if you're Mr. or Mrs. 1%, where if there is a side effect listed, you are for sure going to have it, then something to think about is mast cell activation syndrome, MCAS. Your mast cells are part of your immune system. And part of that, basically, your body has sort of an allergic reaction without any actual allergens. Like you might have a reaction like somebody else might have to pollen or something like that, but without the pollen, right? So with this, I often will suspect this when a client is, everything that we try, if they try a supplement or they try a medication, and everything we try almost seems to make them worse instead of better, I suspect something going on with the histamine reaction with mast cell. This also points to racing heart, digestive issues, things like that. Those all can be involved with mast cell. A couple of my clients who have mast cell issues are almost allergic to eating. You may have heard of the low histamine diet. This is part of this whole mast cell equation here. And eating certain foods or leftovers, for instance, if things have been sitting around, the histamine level in that food goes up and your body reacts to it. So working with your immune system might be a specialist, like an allergist, might be a naturopath. Your primary care might even know something about this. This is becoming something that more and more people have been talking about lately. But learning about that and really adjusting for that can be a huge piece of the puzzle. One of our most recent students who graduated, this was one of the big things, actually for two of them, but one person in particular, realizing that she was dealing with this, taking out the things that were causing a reaction, making sure that she was eating fresh foods and things like that made a massive difference for her. And they were all things she was blaming on fibromyalgia, right? The fatigue, the brain fog, all of that. So again, for me to suspect mast cell, it could be suspected in a lot of cases, but the thing that points to me that is different than fibromyalgia are those things like being extra sensitive to medication or taking the thing that's supposed to help you feel better and you feel worse. That's when I start suspecting that. Tremors. I mentioned tremors. Sometimes people will have tremors with fibromyalgia from things like overly tight and stressed out muscles, right? Like we've all had those eye twitches or muscle cramps or even shaking of your hands or your arms because a muscle is just so fatigued. It's like, sorry, can't work anymore. But these tremors are a little bit different. And when someone talks about tremors with their fibromyalgia, we'll dig in a little bit to that, but then I'm often going to be referring them to their doctor and the neurologist because there's some pretty serious things that can cause tremors, things like multiple sclerosis, MS, Parkinson's, things like that. And so we really want to make sure to catch that early if that's what's going on. So again, not to freak you out, not to have you diagnose yourself from this podcast, but tremors are typically not something that we see with fibromyalgia. So when that happens, we definitely want to dig in a little bit more. This is one of the ones that is definitely serious conditions could be causing that. So we want to check it out. Same thing with headaches, right? Like we all have heard the, could it be a brain tumor thing? We really do want to get these things checked out and make sure. Digestive issues that you're having, we want to make sure that's not colon cancer, right? We don't want to automatically assume that that's the first thing, but we also don't want to miss it because we're not looking deep enough. And then the last thing that I mentioned on that list of symptoms was nerve pain or pins and needles in your hands and feet. This could really be pointing to some kind of neuropathy. So it could be something like peripheral neuropathy. Small fiber peripheral neuropathy is something that has been diagnosed with a lot of fibromyalgia patients, or other types of neuropathy, like diabetic neuropathy. Nerve pain tends to be more of that pins and needles type of feeling. And what I mean by that is like if your foot falls asleep and then as it's waking up, that prickly feeling that you're having, That tends to be more nerve pain, burning, tingling, numbness. Those all are nerve pain symptoms, which point to different things than deep, achy muscle pain type stuff or joint pain type stuff. Now, small fiber neuropathy, since I mentioned that one, this is a condition that happens when there's damage to the peripheral nerve fibers. It's called peripheral neuropathy because it typically happens arms, legs, hands, feet, your periphery, right? Sometimes you'll feel it on your back. There was one study done in Boston years and years ago that showed that half of the fibromyalgia patients in this particular practice were diagnosed with small fiber neuropathy in addition to fibromyalgia. One of my clients was diagnosed with small fiber neuropathy as her primary diagnosis and developed fibromyalgia secondary to that. So for her, a big piece of keeping her fibromyalgia under control was making sure that her neuropathy was under control. Again, that amplifying effect, right? We want to make sure that that's taken care of. Now, there are so many conditions. I mean, there's just so much stuff, right? Like I can't list it all. But those are some common things that I see that I really want to point out to you as possible other conditions to check into and get a diagnosis for and get treatment for. I just also want to mention a couple other that are on the list that I have just because I see it so often. One is, of course, chronic fatigue syndrome. Fibromyalgia and chronic fatigue syndrome are often considered one and the same or two ends of the spectrum of one condition. I personally think that they're probably two different things, but we honestly don't fully know. I've just seen too many research articles that point to differences between the two things. Chronic fatigue syndrome is also sometimes called ME or myalgic encephalomyelitis, which again, I'm not going to spell for you, but it does seem to have a few things different than fibromyalgia. When someone has chronic fatigue or ME, what we see is fatigue on a whole nother level. So if you think of like a normal average person and the kind of fatigue that they feel, like maybe they didn't get enough sleep one night or just are chronically sleep deprived and exhausted because of the crazy pace of our lives. And then you think of fibro fatigue. Maybe a regular person is at a 10 and we're at a 20 with fibromyalgia. Chronic fatigue syndrome is like a whole nother level. Maybe they're at a 30. So your normal, stressed out, exhausted professional out there is at a 10, fibro's at a 20, chronic fatigue's at a 30. I see it on a whole different level. The name is part of what's so confusing for this because fibromyalgia does include fatigue that is chronic in nature. So chronic fatigue, lowercase letters, but that's a different thing than chronic fatigue syndrome, which is why a lot of people are taken to calling it ME or ME/CFS and really differentiating the two things because it's a whole different level. With ME/CFS, I do often see fever, swollen lymph nodes, sore throat, some of those more sick, like you're coming down with a cold or a flu, some of those more sick type feelings. That tends to be something more like ME/CFS and different than fibromyalgia. ME/CFS tends to have a viral component to it. Stanford has done some really, really great stuff in their chronic fatigue syndrome clinic. So definitely check that out. But there does seem to be a viral component to that, as with Epstein-Barr virus, which is another, obviously, it's in the name, another virus. This is human herpes virus 4. This is the virus that causes mononucleosis. So this has very similar type symptoms. Of course, all the same symptoms as fibromyalgia, but in addition, they're going to have fever, the swollen lymph nodes, the sore throat, those things that indicate, oh, my body is fighting off something. And that's what we see with Epstein-Barr. If you had mono as a kid, there is a chance that that virus can sort of reactivate and raise its ugly head and come back again. This is one of those things that is a little bit controversial, maybe, in the medical community. A lot of doctors don't realize that this can reactivate and pick back up and cause problems again. The test that's often used is one that's just sort of a binary yes, no, have you had it or not whether or not that virus is active. And so there's a different test for that. And you really need to find someone who really truly understands that. I also want to mention Lyme disease. It kind of falls into this same controversial category. Most everyone is agreed upon the fact that Lyme disease is a real thing, but the difference is whether or not chronic Lyme, so something that goes on for years or months, is different than I got a tick bite and for 2 weeks I've been sick. Right. So this again can be really controversial, and it's different tests, different things to look at if that's an ongoing infection or not. And this is actually a bacterial infection. But one of the really interesting things about Lyme disease is that it can be radically different symptoms. Even throughout the day, minute to minute, you can have different symptoms. We do see more neurological headache type symptoms, such as tremors, shaking, headaches, inability to speak properly, almost like having a stroke or having MS. A lot of people diagnosed with Lyme disease were first diagnosed with MS. So this is a big one to really make sure you have the right thing. You can diagnose MS by looking at MRIs and really looking at your brain and looking for lesions and all of these things, which of course you won't see with Lyme disease. So we can double check that. But really, treating a bacterial infection is much different than treating an autoimmune condition that is attacking your central nervous system, which is what MS is. Of course, we've got a lot of different types of arthritis as well. Rheumatoid arthritis, RA, a lot of people are familiar with, an autoimmune condition that primarily affects your joints. Yes, you can have RA and have fibromyalgia. You can have an autoimmune condition that's affecting your joints and fibromyalgia that's then amplifying it. So we want to make sure of that. And I also want to briefly mention TMJ issues, or TMD, as it's technically called. As one of my doctors said, everybody has a TMJ. That's your temporomandibular joint. That's your jaw joint, right? So saying you have TMJ, well, yes, we all do. But having the TMJ disorder, right? So TMJD or TMD, that is a different thing. And this is where you've got that pain in that jaw joint. It can cause headaches, earaches, neck, shoulder pain. Some of the symptoms of TMD can even feel like toothaches, right? Like people have had teeth pulled thinking that was the problem when it was really coming from somewhere else, something else. A lot of fibromyalgia patients have TMD, but it is a sort of a side effect of increased pain responses, right? Like you might actually clench your jaw because you are in pain. And then that jaw starts to lock up, be extra tense, cause its own pain. And then fibromyalgia, of course, amplifies that, right? Aren't we so lucky? So a lot of the things that I've mentioned here today have completely separate, sometimes very different treatment options than what fibromyalgia has, right? Like we are going to treat a viral or a bacterial infection in a different way than we're going to treat an autoimmune condition or fibromyalgia, right? They are all different. So it becomes really important to have an accurate diagnosis, especially when it comes to medications. I've talked to way too many people who went too long with the wrong diagnosis. One of my students was diagnosed with an autoimmune disorder and was treated with some pretty heavy autoimmune medications for many, many years before it was found out that what she actually had was fibromyalgia. And all those autoimmune medications she didn't need at all. So, really be listening for these clues. Get to know the real thing, like that story I shared at the beginning about the bank tellers, right? Really get to know what is fibromyalgia, what is not fibromyalgia, how is fibromyalgia treated, what are the medications, supplements, therapies, how do they help? The more you know, the better you know, the easier it is to spot the outliers and the things that say, oh, maybe this is something different. Maybe I need to talk to somebody about having this checked out because it's not part of the norm. So many of you have emailed in questions along the lines of, is this fibro or is this something else? Or how do I know if this is my arthritis or if this is fibro? And the answer is just really get to know it, know the real thing so that you can spot what it isn't, right? A good way to do that, of course, is learning all you can, whether that's through books. Of course, you're welcome to work with a coach or take our Certified Fibromyalgia Advisor class. That's what that is all about. Teaching you everything I can about fibromyalgia in 3 months, or even just working with a coach, right? If you need help right now and don't have time to learn it all yourself and you want a little bit of guidance, the best way to do that is to talk to a coach. We would know because we talk to so many people. Like I said at the beginning, I do not diagnose my clients, but I have been doing this for a minute and I can kind of spot the things that sound like fibro and the things that don't. Go also and check out those other podcast episodes if you'd like to hear a little bit more about them. Stay tuned for the future episodes where we're going to talk about Sjogren's, and I'm working on booking people to come talk about other specific conditions because, of course, fibromyalgia is my specialty. Sjogren's is not my specialty, which is why Brenda's going to come talk to us. So do pay attention to those and hopefully use this episode to kind of clue you in on where those other things are that you should maybe check out. All right. And as I wrap it up for you today, first, I've got our listener shout out, and then I've got another episode I want to point you to. With this week's listener shout out, this is actually a review that was posted in Apple Podcasts. And it's back from July, and it says, Best Fibro Podcast is the title, 5 stars. And I don't know if this is a male or a female, but the listener says, I've listened to several podcasts on fibromyalgia, and it felt like I was wasting my time. Then I came across yours, and I became hooked. I work swing shifts, and when I'm working overnights, I listen all night long. The fact that you post notes makes it all the better. Thank you. And thank you so much for posting that. Oh my goodness. I get so many emails and love notes from you guys out there, but I would love for you to put those reviews out as well. It just sometimes can help people to know, is this something I want to spend my time on? If other people say, yes, this is good, or no, it's not. So if you have written in and told me how awesome the podcast is and how much you enjoy it, please go to wherever you listen to that and post that as well. I would love that. And who knows, maybe I'll use you as one of our listener shout outs. Now, the last thing I want to mention to you, as we are in September, I've noticed that the stores are starting to switch over to all of those jack-o'-lanterns and pumpkins, getting ready for Halloween time. And so I want to remind you about the Teal Pumpkin Project. I talked a lot about this back in episode 21, so we'll have a link to that in today's show notes when I talk about the Teal Pumpkin Project in that episode. It's right at the beginning. So you can just listen to that first part, or you can listen to the whole thing if you like. But the part about the Teal Pumpkin Project is right at the beginning. And the cool thing about the Teal Pumpkin Project is it's really what it sounds like. It's a teal colored pumpkin, and you put it outside or wherever it is that you are potentially having treats for your trick-or-treaters. And the teal pumpkin indicates that you have non-food items. This is something that was started by the food allergy group, and really for those kids who have food allergies. We've heard about kids who are deathly allergic to peanuts, for instance. You don't want to go to the house that's giving out Snickers, right? So the teal pumpkin can be a really good indicator for the kids and the parents that it's a safe house for treats for their kiddos. My parents have been doing this for years, and at first they started doing both non-food items and treats. And at this stage of the game, they've just switched over to all non-food items. The kids actually get more excited about that because, you go home with this bucket full of candy. Sometimes it's nice to have something a little bit different. So when I talk about non-food items, I mean things like fun pencils or erasers, or, those Super Ball bouncy balls, or stickers, or fidget spinners, all kinds of different inexpensive things that can be given out instead of food. And the reason I bring it up on this podcast is because so many of us with fibromyalgia do have various kinds of food sensitivities, even if it's as simple as we shouldn't have too much sugar. So think about those kiddos, think about your own kiddos and what you might want them to have. I mean, just thinking about how healthy we want to be, right? Non-food items are better than a bucket full of candy any day. So go check out the Teal Pumpkin Project. You can just go to that website, Teal Pumpkin Project. We'll have a link in today's show notes, and that will give you a little bit more information. And like I said, if you want, go check out episode 21. I think in the video for that, I even have my teal pumpkin that I show you. I noticed at my allergy clinic when I got my allergy shots this last week, they had all their teal pumpkins out. So it was pretty cool. So go check that out, and we will see you back here next time. And that wraps up another episode of the Fibromyalgia Podcast. I'm your coach, Tami Stackelhaus. For daily doses of hope, inspiration, and practical advice, come hang out with me on Facebook. Visit facebook.com/fibrocoach to find my personal coaching page and connect with me directly. To find the show notes, additional resources, or to schedule a consultation with me or one of my coaches, visit fibromyalgiapodcast.com.